Hello people, in this video let us look at this topic, health information. So it is a good thing. So let us make it like this, health information. So what is it? It's a mechanism for collection, processing. So you collect some data, process it, analyze it and transmit this information which is required for organizing and operating the health services and also for doing research and training. A very standard definition for any information collection. Okay, so what is it? It's a mechanism of collecting, processing, analyzing the data, transmission of the information for organizing, operating health services to do research and training. So that is health information. So what do you mean by data and what do you mean by information? Data is something that is raw. So you just collect some numbers, but it doesn't make any sense. It makes very little sense. Then what you do, you convert this data, you analyze it, you transform it, you make all these charts and you see the trend is increasing, decreasing, you link things and then you understand, you summarize. That becomes information. Information has information. Exactly. It's more useful. So basically you go to a hospital, they collect your data, they collect your information, etc. So what are the requirements that have to be satisfied by these health information systems? So these health information systems should be population based. They should have some, they should not have some unnecessary data. They should be problem oriented. You should be able to solve some problems with using that data, right? So they should have some functional and operational terms. Right? What are the terms like episode of the illness, the laboratory test, the treatments that were given, the outcome, etc. Right? So there should be some functional and operational terms. You should be expressing them imaginatively. Right? Charts, tables, percentages, all those beautiful graphs and sketches that you can make, how it is going up and how it's going down, the diseases are going down, etc. The system should make provision for feedback of data. Okay, so some feedback mechanism also required, feedback of data. Okay, so this is the WHO requirement. What and all are the requirements? So till now, what and all we saw? We saw health information system, what the definition is. We saw the difference between data and information. Now we are looking at the requirements as per WHO. It should be what, some functional terms should be there, operational terms should be there. Basically, it should be problem oriented. Unnecessary data should not be there. What was the first one? The first point we saw was it should be population based. Okay, this looks like I will forget this word, population based. Okay, then you should be able to express it imaginatively, tables, charts, percentages, etc. So avoid the unnecessary data. Okay, avoid the unnecessary data. Okay, then lastly they have said feedback, make provision for feedback of data. Okay. Now, what are the components of health information system? Components, okay. Here there are very, very specific terminologies. Components are different. Sources are different. Now, components, what are components? Demography. Demography means what? The study of the people, right? So you will have population study. That's like the growth rate, the population growth rate, fertility rate, birth rate, death rate, right? What else you would like to know? That's all. Okay, then coming to vital events. What will the vital events be? Vital events will be like birth, death, marriage, divorce. So many things are vital events. Okay. Then these are components. Okay. Environmental health statistics. Environmental health statistics. Health status, mortality, morbidity, disability, quality of life. Health resources. What are the facilities, beds, manpower, utilization of these health services. You should know how many admissions were there, what was the waiting list for the people, what is the outcome of a medical care. So you gave some treatment and how did that turn out. Then coming to financial costs, how effective, I mean, how cheap, how costly. So basically these are components. Now when they ask you components, really it won't flash in your mind. What are components of health information system? Demography, vital events, admission rates, mortality, morbidity, hospital resources, how many we have, utilizing, is it happening, the outcome of a medical care, what are the costs. It's slightly difficult to remember this. Okay, let's go to the next one, uses of health information. Now all this information that you have, how will you use all this information? You have the information on health statistics, health status, the outcome of medical care, financial statistics, you have the demography details, you have the vital events. How will you use all this? So you will use this to measure the health status of the people, to quantify their health problems, to understand what exactly they need, to compare, local comparison, national comparison, international comparison, compare all your health statistics with the entire world, how you're going. Planning, how will you plan, what do you need to do, administration, what programs you need to bring forward. And you want to understand whether health services that you're giving are efficient, right? Then are the beneficiaries satisfied? Then again, always in the end, write one word, research, important, okay? Research. Everywhere in the end you should write. It's used for research. Now coming to the major part, guys, sources of health information. There are 14 sources of health information. Look at these, okay? Health information sources. You have census, registration of vital events, sample registration system, disease, something about diseases, notification of diseases, hospital records, disease registers, record linkage. Just remember, records, record linkage, disease, notification of diseases or disease registers. Who will notify the diseases to the government? The doctors, hospitals will notify some diseases to the government, right? Then some surveillance, epidemiological surveillance, health service records, environment health data, health manpower statistics. That is, you will try to understand how much of manpower we have. Population surveys, then other routine statistics. We'll come to all this. And finally, some non-quantifiable information. You can't even quantify some information. What are all these? We'll have to look at. How many are there here? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 14 health sources of health information according to the textbook. It's difficult, right? Yeah. Census, some sample registration, then registration of vital events. Those three are one category, let us say. Then you have disease, notifiable diseases, disease records, hospital records, record linkage. Then you have epidemiological surveillance for all these epidemics, endemics, etc. Health service records. Actually, these records can go with these records. So just group these things in your mind so that you will know these 14 points. Environmental health data, manpower statistics, population surveys. Because the textbook gives it in this order. Otherwise, I would have put this health service records with these records here. And put these population surveys along with census here. So it's easy for us to remember all these points, right? Okay. So now let us get into census. So this is census. Our census is coming, 2021. Look at the definition of census here. Total process of collecting, compiling, publishing demographic, economic and social data. 3 words should come here in census definition. What are those 3 words? Demographic, economic, social data. So demographic is the population. You collect their economic and social data. Okay, demographic, economic and social data pertaining at a specified time or times to all persons in a country or a delimited territory. So census is a massive undertaking. In our country, it is every 10 years, right? It's a massive undertaking. It's written here if you're not able to see. It's a massive undertaking every 10 years. What is the drawback of census? There's so much data, you will not get quick results, right? The first census was 1881. Every 10 years they're doing. The last census was 2011. So when is going the next census? 2021. Get ready for it. Okay. So total count of population you will take. Then you will have subgroups like age, sex distribution. You will know their economic and social characteristics, how they live, what conditions they live under, what work they do, and their income also. Okay. So how will you use all this data to provide all the health services? Okay. Next one, what did we say? Registration of vital events. What are vital events? Births, deaths, marriage, divorce, etc. So related to births, you have adoptions, right? So something like this, you will have to register everything. So you have the Central Births and Deaths Registration Act 1969. Remember the Central Births and Deaths Registration Act 1969. So you have to register births and deaths within 21 days. There's something here called a sample registration system, SRS. Okay. So this is every 6 months. That is half yearly survey. You will try to estimate birth and death rates. So this is a very reliable, very, very good system it is. So they are saying it's the more reliable information on births and deaths rates, age specific fertility, mortality rates, infant under 5 and adult mortality. So this is a very good thing. They like it a lot. Every 6 months they will do this. Okay. Unlike census, which is every 10 years. And they love this system. Looks like most reliable. Okay. They're not saying most reliable. They're saying more reliable. What about this population survey? Is it different? Shall we go and check this out, or just let's go in order? So population survey says health surveys. So surveys for evaluating health status, investigating the factors, health status. Same word, somehow they will just twist and write. Administration of health services, use of health services, people are using or not. What methodologies they have here? Health interview, face-to-face survey, health records, you will try to read. So many surveys are there here. National survey, sample survey organization. They have some questionnaire. Just to remember, I would like to put this population survey here so that you know you're going door to door and collecting some information. But remember, instead of going door to door, you can also just look at all these records and get the information. Now let's go to this one, diseases. Notification of diseases, disease register. Let's just link these two together to help us. See, notification of diseases means infectious diseases and also non-communicable diseases. Some of them have to be notified to the government, right? So which are these diseases which pose a serious menace to the public health? What are the examples? Like WHO says, like cholera, plague, yellow fever. Was cholera there in Bangalore just 4 months ago? I thought cholera was there. Wait. See, this was March 2020. 6 cases of cholera reported in 1 week in Bangalore. So yeah, so it is not that uncommon. Plague, yellow fever, and lot of other things. Okay, just remember cholera, plague, yellow fever, that much you remember. A lot of other things are there. Obviously, polio you will report, malaria, rabies. Rabies, okay, let us say, okay, rabies, polio. So many things are there actually. Okay, that is WHO level. At international level, this is. I think in India, tuberculosis, etc. will become notifiable diseases. Okay, so what are the problems with notification? So you should understand the problems with notification. Limitations also will be there. There are serious limitations, they are saying. So it covers only a small part of the total sickness of the community. See, obviously that iceberg phenomena, you will see only tip of the iceberg, right? The doctor, and he will notify only this. And there will be a lot of underreporting in that also. And sometimes there is no accuracy of diagnosis, so unless you have all these microbiological laboratories, etc. And such facilities will not be there in rural areas. So what are the non-communicable diseases which are going to be notifiable? You have cancer, congenital malformations, mental illness, stroke, handicapped persons. So this will be non-communicable diseases which have to be notified. Okay. Now let us look at this terminology. See, we saw notifiable diseases. Now disease registers. A register that is a permanent record it is. Okay. So it is a morbidity register. There's something else like that. Duration of illness, case fatality, survival is a permanent record, something like that. Now let us look at this one. Hospital records, record linkage, other health service records. Everything has a records word in this. Hospital records, record linkage, other health service records. Let's look at these. How's it going, people? Is it becoming too much to handle? Yeah, this topic has a lot of such things only. Hospital records, hospital data, it constitutes basic and primary source of information. This is just tip of the iceberg because hospital will get only clinical cases. Hospital discharge sheets contain so much of useful information on the diagnosis, on the medical and surgical procedures, complications, length of stay, laboratory data, etc. So obviously you have seen all your hospital discharge, hospital records, right? They'll have a lot of information. So you will also get the geographic source of the patients, the age and sex distribution, the period between the disease and the hospital administration, the cost of hospital care, bed occupancy rates of the hospital also you can find out. Record linkage, you will try to link all this of one individual's information, you will try to link it. Like even family information you can try to link, right? The twin studies, etc. for genetic studies, etc. you can try to link some things. Other health service records, like what? In outpatient departments, is it? Okay. Primary health centers, sub-centers, school health records, immunization records, etc., etc. A lot of types of records. We're done with this much. Now we have to just look at this much more. Epidemiological surveillance. For the, basically on the disease, you will do some surveillance. Environment, yes. Health manpower statistics. and some other statistics is there, other routine statistics, non-quantifiable information. Okay, we have to look at these by now. Epidemiological surveillance, in particular diseases which are endemic, that means always there, you'll have to check efforts to control diseases like malaria, tuberculosis, leprosy, filariasis, etc. You'll do all this, right? Just write some epidemiological surveillance. So environmental data, this is a source, we're talking about source, environmental health data, noise, pollution, harmful food additives, industrial toxicants, air pollution, water pollution, all that you remember, okay? And whenever they say environment, remember all that. Well, let's look at these two. They have the word statistics in them. So let us see if we can link these two and understand. Health manpower statistics, other routine statistics. Health manpower statistics, that is the same thing, right? You will know the number of doctors and all that. Don't tell me that is not what it is. I think that is what it is. Yes. Dentists, physicians, dentists, pharmacists, veterinarians, hospital nurses, medical technicians, etc. You will maintain all this information. Other routine statistics related to health. So demographic, economic and social. Isn't this so similar to that census, economic, social, etc.? What will you maintain here? Consumer goods. What is this? Consumer goods such as tobacco, consumption of tobacco, sale of drugs, per capita income information, then social security schemes, demographic, population density, education level. What is this? Just some other statistics. Okay. Health statistics, health worker statistics, not at all difficult. Number of doctors, number of nurses, etc., etc. And other routine statistics means what? Some tobacco consumers and things like that. Now, lastly, non-quantifiable information. Some information that you cannot quantify. What is that non-quantifiable information? Tell at least one word which makes sense to us. Health policies, health legislation, public attitude, procedures, something like this. Some non-quantifiable information like attitude. Okay. This is an important topic, guys. Health information. The questions you will get in the exam are something like this. Health information system. Define health information system. Components of health information system. Uses of health information system. So define, we already told you how to define, right? To collect all the information, analyze, give it for, process it, use it, to build everything, research, etc. What about the components? Components we told you, demography, vital events, then what else we told you? Health resources, facilities, the utilization of these services, outcome of medical care, financial statistics also. Then they'll ask the uses of health information system to measure the health status of people, what exactly they need, to international comparisons, planning, administration, assess whether health services are efficient, are people satisfied, research, always in the end write research. Then they'll ask you the sources of health information system. What are the sources? Census, registration of vital events, sample registration system, population surveys, notification of diseases, disease registers, hospital records, record linkage, other service records, epidemiological surveillance, environmental health data, manpower statistics, other routine statistics, and non-quantifiable information like what? Attitude. Okay. Then what else they will ask you? And they will ask you disadvantages of hospital records. What are the disadvantages of hospital records? See, people choose to go to a hospital based on their economy, etc., right? So those can be admission rates. Okay, the main problem is tip of the iceberg. Hospital will have only tip of the iceberg. Okay, the admission policy may vary from hospital to hospital. So there will be very selective data. So many people won't go to hospital. So hospital records will be tip of iceberg only. Okay, then notification of diseases, they will ask you what are the notifiable diseases and what is the merit and demerit. Merit, okay, you get information into the health information. Then demerits, we told you, right, that there's no proper diagnostic laboratories, etc. Underreporting will happen. Then what else? Again, here it's only the tip of iceberg. Then they'll ask you about medical records linkage. So what will you do in medical records linkage? You will take one individual's or a family's information and collate everything together, and basically you'll try to see the linkage between these diseases, etiological significance, etc., etc., twin studies, genetic studies, etc. Then, so this one, Registration of Vital Events, Central Birth and Death Registration Act of 1969. Remember 1969, within 21 days you have to register birth or death. And anyways, the hospital will have a record of the birth or death, okay? They do give proof of birth or death. So this birth or death, just remember guys, when 1969, compulsory registration, okay, it is in force from 1st April 1970, okay, leave that. So basically even adoption you have to register, because that is like childbirth kind of a thing, right? So the responsibility of public, the parents, relatives, hospital heads, nursing homes, etc., people to register. Where will you do? Good. There will be a registrar. Registrar word is important. That is where they will register. Okay. A late fee is imposed if they don't come within this 21 days. So this completes this big topic, health information, sources, components, uses, what health information exactly is, etc. That's all for now. Bye bye.